Good evening, viewers. As you all know, today's topic is liver, and liver is not a small organ to talk. I can talk about it's a big encyclopedia. So I'll try to limit my talk or give you a eye view of what facts about liver and how to prevent and what diseases can occur in liver. So as you all know, today we are here in this talk on the liver World Liver Day, which is on 19th April. And today is also incidentally one other day. It is um, IBS Day, that is Irritable Bowel Syndrome Day. And now facts about your liver. As you all know, liver is the largest internal organ, second only to the skin, and it is located in the right side of your abdomen, just below your rib cage on the right side. And you all know it's a big organ and it weighs about 3 to 4 pounds, approximately 1.6 to 1.8 kgs. And it has two lobes. The bigger one is the right and smaller one is the left lobe. And you know, this is a big organ which has more than 500 vital functions, which are very, very important for our body functioning. And we cannot live without liver, of course. And it is the metabolic headquarters which absorbs extra sugar and also stores it as fat. Now we will tell the basic functions, limiting it to about 9 to 10 functions, because I can't tell all 500 functions of the liver in this today's talk. So mainly it helps in the production of bile and excretion of this bile, excretion of bile, cholesterol, hormone, and drugs. It also metabolizes our fat which we eat, proteins, carbohydrates, and it activates our enzymes for the digestion. So all these things are needed for our digestive process, and it also acts as a storage organ for glycogen, vitamins, and minerals which are needed by our body. It also synthesizes plasma proteins, which are very, very important part of our daily system, and also it gives a lot of albumin. It also manufactures our clotting factor, which is very necessary in the clotting mechanism of our body. It detoxifies and purifies our blood. It also resists infections and it stores energy. It controls cholesterol. It processes digested food and increases our immunity. So tell basic functions of this, and we all know that the what importance of liver is. And today is 19th April with the intent to raise an awareness of the liver disease to the general public. The World Liver Day focuses on activities pertaining and to educate on the severity, early detection, prevention of the liver diseases. As, as we all know, it's the second largest and most vital organ in the human body. Liver plays several functions. Although it's unique, it has a self-healing capacity. It can regrow and also regenerate till about 60 to 70% of it damaged. So when there is a damage of more than 70%, only we will know what exactly is happening or the symptoms will appear. Today being World Liver Day, we should know the theme for this year. This year's theme is be vigilant, do regular liver checkups. Then fatty liver can affect anyone, irrespective of the age or sex or your weight. So this theme focuses on the emphasis of practicing regular liver checkups. As fatty liver can affect anyone, irrespective of the risk of obesity or diabetes or excess consumption of alcohol. There's a recent study from India itself which shows that 70% of the non-alcoholic patients also develop fatty liver. There's the liver disease caused in patients who do not drink or who drink very less or minimal alcohol. This is observed even in low body mass index people of less than 25 kg per square meter. So in comparison to 2005, there's almost 30-35% increase in new cases annually, and this can be more when we go to 2030. The spike in this number is due to lack of awareness regarding the disease. Seriousness is not there. Then there are also associated risk factors which people do not know. There is right now, if you plan, we can prevent this disease. On this day, experts like hepatologists, gastroenterologists, surgeons, and also healthcare workers are stepping forward to enlighten the public about the risk of this liver disease and how to prevent, including diet and lifestyle modifications. So, for us to know when is the liver disease, how do you know this guy has liver disease or not? because 60 to 70% of the liver symptoms don't occur till the liver is disturbed till this day, 60%. The symptoms occur like skin and eyes become yellowish. There is nothing but jaundice. There is abdominal pain and swelling. We will see swelling of the legs and ankles. There will be itchiness in the skin, and the urine will be dark. There will be pale stools. Patient feels very weak. There is chronic fatigue. Patient vomits. There can be vomiting sensation. He doesn't feel like eating. It feels like throwing. There's loss of appetite. And whenever a small injury or he touches something hard, there is a tendency to bruise because the clotting factors are decreased and he tends to bleed. And in the later part, when he opens his hands and shows to you like this, he can be shakiness. It's called the flaps or the tremors. And when it affects his brain, he can be drowsy. There can be confusion and also forgetfulness. So these are some of the important symptoms which will make us realize that this patient is liver is having some issue. So having said this, now we will go into what diseases can cause these symptoms in the liver. So most importantly, it's the viral markers or the viruses which can cause damage to the liver. It is called the viral hepatitis. Second one, as we all know, it's because of the fat, sedentary life, and consumption of excess calories, which can lead to fatty liver disease. And that is genetic liver disorders which can run in families like hemochromatosis, alpha-1 antitrypsin deficiencies. Then also autoimmune diseases wherein our liver is being attacked by our own immune system. Then also, as we all know, the most common which can be prevented is the alcoholic liver disease. As the name suggests, it is because of the abuse of alcohol. And all the 5 or 6 diseases which I pointed out can lead to cirrhosis. Cirrhosis is the stage where the liver cannot reverse, and from here, if the abuse continues, there can be complete liver failure, or there can also be a cause of cancer, like the primary hepatobiliary cancers can come. And so all these things are the most important diseases. So these diseases again are related to toxins like alcohol, sometimes drug abuse like a lot of paracetamol, overdose of other medications, and a lot of herbal and Ayurvedic products which have heavy metals. Patient just keeps taking them without any prescription or anything, and sometimes continues the doctor's prescription for years together, and he takes over-the-counter medications, and all these are toxins. And the infections like viral hepatitis, Epstein-Barr viruses, and also cyclomegaloviruses, all these are common causes, and also metabolic diseases like Wilson's disease, hemochromatosis, etc., and cancers, primary cancer in the liver or secondary cancers from elsewhere, which can come and affect the liver. Autoimmune diseases wherein our body fights with the liver, thinking that our liver is a foreign body, and this is called autoimmune hepatitis or primary biliary cholangitis, or there can be some vascular diseases wherein the venous outflow of the liver, the blood vessel outflow of the liver is affected. So what are the risk factors which can affect all these diseases? Again, it is the heavy alcohol use, obesity, type 2 diabetes, and tattooing or body piercing. We should be very careful, it can spread hepatitis. Injecting drugs using shared needles, then blood transfusion which had occurred before 1992 when there was no actual testings of hepatitis B, C or H2. Now everybody is aware that blood when given has to be tested, both the technical person as the patient, everybody knows it. Then unprotected sex, and never get exposure to other people's blood and body fluids. Exposure to certain chemical and toxics, even aerosols, and family history of liver disease has to be kept in mind as one of the risk factors of the disease. Now we'll go to very important thing, hepatitis. What is hepatitis? Nothing but inflammation of the liver. So there is an inflammation by which the body reacts to either the injury or the infection. The body part becomes reddened, swollen, hot, or painful. So just like when there is an infection in the tonsil, we call it as tonsillitis. When there is an infection in the appendix, we call it as appendicitis. And when there is an infection in the liver, we call it as hepatitis. Hepa means liver in Latin, and itis means inflammation. So what are the common types of hepatitis? Viral, usually it is hepatitis A, B, and C. So it can be acute hepatitis or chronic hepatitis. Acute means it's a very short duration hepatitis. Chronic means it can be long-standing infection, which can lead to cirrhosis and other complications. Having said hepatitis, we'll go into the viruses. What are the viruses which can affect the liver? Mainly hepatitis viruses are five: hepatitis A, hepatitis B, hepatitis C, hepatitis D, and hepatitis E. Now, how are these viruses spread? So, hepatitis A virus is spread through contamination of food and water. Hepatitis B is spread through infected body fluids. Hepatitis C is again through infected body fluids, then unsterile medical equipment. Sometimes it can, it can be transmitted from mother to child. If the mother is HCV positive. Then hepatitis D, as you all know, it's oral blood or fluid contact with an infected individual. And hepatitis E is fecal-oral route. When there is a contamination of the water with the feces of the infected person, and the other person swallows that unsterile water, then this disease can come. It also can come from uncooked meat and uncooked fish. And now, how do you prevent this hepatitis? Luckily for hepatitis A and hepatitis B, we have vaccines. It can be prevented. So it's advised that everybody takes hepatitis A and B vaccines. And for hepatitis A, hygiene is very, very important. And hepatitis B, never get contact with blood things. And screening is very important. And hygiene is also important. And vaccination for hepatitis B. Hepatitis C, again, blood screening, don't get contact with the blood fluids and sterile medical equipment. The prevention for hepatitis D is practice safe sex, right? Don't share any equipment with anybody. And hepatitis E is good water, clean drinking water, avoid uncooked meat and uncooked fish. So what are the things to stay free of hepatitis? It has to be good hand washing. Don't share razors or toothbrushes. Have protected sex. Be careful if you are getting a tattoo or piercing anywhere. It has to be sterile. Better to use the new equipments. Don't inject drugs or share needles. If you have sex, I have already told, it has to be protected sex, and always get vaccination. There are certain myths. See, this hepatitis will not spread through food and water sharing. Sharing in the eating utensils, kissing on the cheek, hugging or holding, or it is not transmitted in breast milk for hepatitis C mother. Now, the most important thing is non-alcoholic fatty liver disease. Okay, is a term which we call or donate a range of denote the range of conditions caused by fat in building in the liver. So fatty liver occurs when the liver stores too much fat in the cells. It happens when your diet is too rich in calories or fat, or you lead a lifestyle which is sedentary. The symptoms are very few and can usually go unnoticed till about 60 to 70% of the liver as fatty liver, and when it has progressed further. So when it is unchecked, this can lead to a lot of problems. So be vigilant, get your liver tested, and avoid fatty liver by doing regular exercise and other modalities. So fatty liver refers to deposition of excess triglycerides or fat in the liver. Normally, the fat in the liver is less than 5%, but in this cases, it increases from 5%, and we classify it as mild, moderate, and severe. And these deposits of fat not only in the liver, it usually is accumulated in the entire cytoplasm of the liver cells called the hepatocytes. It causes impaired metabolic function of the liver. So there are a lot of derangements. All liver functions are destroyed, and our body becomes very, very weak. It is associated, finally, that injury will lead into fibrosis. Fibrosis is nothing but scarring of the liver, and finally it leads to a condition called cirrhosis. And this cirrhosis ultimately leads to liver failure and as well as cancers. So I've already told excessive fat accumulation in the form of triglycerides or fat more than 5% is called non-alcoholic fatty liver disease. If the same fatty liver disease gets liver cell injury and inflammation, in addition, it is called NASH, non-alcoholic steatohepatitis. And I will just show it in diagram. What you see is the normal liver. Here you see the alcoholic fatty. This is normal liver. This is the alcoholic fatty liver, and this is the alcoholic steatohepatitis. When there is injury, and this becomes, when there is fibrosis, it becomes like this, and this is from here onwards, it can't be reversed, and finally it proceeds to cirrhosis. You can see here, this is normal liver, fat accumulated, fat injury, and fibrosis, and finally this cirrhosis. From here, it can't be reversed. So till here, it can be reversed. So this is the process how the liver goes, and finally it goes into failure. And so there are some additional risk factors like obesity, some disease, some fatty livers run in families. An alcohol drinking pattern, binge drinkers will get it very early. There is gender biasment is there. Males are many males have this disease, and females also have, because the alcohol, even in small quantity, can cause big destruction in ladies. And cigarette smoking is one predisposing cause. Previous obesity or bariatric surgery is another cause. And age above 40 to 50 is, in this age group, it is very, very common. Now, how do you diagnose liver diseases? Again, there are a lot of investigations which are there. In the laboratory test, you can do complete blood count. Sometimes you can see the HB percentage low, total count may be low, sometimes high. And platelet count, because the bleeding factor and the clotting factors will be this. The platelet can come down. Sometimes, because of the cirrhosis, there can also be portal hypertension, and clean vital will be enlarged, and all the manufactured blood cells are manufactured there and they will be stored there. So, this blood is not available for synthesis in the liver or in the body, and hence the platelets will come down, and bleeding time, prothrombin time, vital, all this will come down. And we should always look for lipids. Triglycerides will be high in blood, so we should look for lipids, and we should evaluate for his diabetic status. Do his diabetic status, see whether it is high or not, and see whether this guy has metabolic syndrome. And then finally, the imaging test, what we can do is non-invasive or ultrasound scan. We will detect whether there is fatty liver or not, and it can grade into mild, moderate, or severe. But to know whether there is fibrosis or not, there's an other method or other scanning, same like ultra, it's also ultrasound scan, but it can detect the elasticity or fibrosis of the liver. We call this methodology as fibroscan, which is available in the recent past 5 to 10 years, and it's a very useful modality to know whether the liver can be reversed back to normal or the fibrosis is so much that it can't be reversed, and what best we can do. And the next same information we can also get in MRI. We can do MRI elastography. And having said all this, this is I just given you a bird's eye view of what diseases can occur, how to prevent, and what the things we have to do, what investigations we should do, and what are the risk factors. Now, the most important thing is how we have to prevent these diseases. Let me take 5 minutes on talking on prevention, and then we'll come back. So, to prevent liver diseases, most important is keep away from alcohol. If you have to drink, it has to be in moderation. For women, it is less than 8 drinks in a week. For men, it is 8 to 10 drinks, and no binge drinking. Per day, it can't exceed more than 4 regular drinks. Then avoid risky behaviors. Use a condom during sex. If you choose to have tattoos or body piercing, be picky of the units where you get it done. See the cleanliness and the hygiene, and see whether it is sterile or not. Preferably, try to get a new one, equipment, and then use that. Then seek help if you still have. If anybody is using illicit intravenous drugs, and don't share the needles to inject. These are some of the most important things in the prevention. And having said this, don't ever forget about the vaccinations, because hepatitis A and B are preventable. The vaccines are the most important findings. Then don't use medications, unprescribed medications. And even prescribed medications, you write a prescription to a patient, sometimes it takes that medication for 2 years, 3 years, and come back to you with only complications. What is happened? You can, doctor, this medicine is not acting, I have developed this thing, that thing. By that time, your liver is completely gone. So never use a prescription medicine also for more than the required period. Don't ever use more the counter drugs on your own. And I have also seen patients using lot of Ayurvedic and herbal medicines, which are very rich in high metal, and they get liver diseases very, very early. Then avoid contact with other people's blood and body fluids. That is, hepatitis viruses can spread through this, and it can also be accidental needle stick injury. And also keep the surroundings clean, with, especially with body and body fluids. Next, keep your food safe. Wash your hands thoroughly before eating or preparing foods. If traveling in a third country, third world country or underdeveloped country where the hygiene you have a doubt, then try to use some bottled or good filtrations and wash your hands and brush your teeth regularly. Take care of your aerosol sprays. Make sure you use products in a well ventilated area. Wear a mask when spraying insecticides, fungicides, paints, or other toxic chemicals. Always follow the manufacturer's instructions thoroughly. Protect your skin because it can also be get absorbed from your skin. So use gloves, long sleeves, wear a hat, wear a mask when you are using any insecticide or any aerosol sprays. Then maintain a healthy weight. Obesity can cause non-alcoholic fatty liver disease. Eat a balanced diet. Avoid high caloric meals. Then saturated fats, refined carbohydrates like white bread, white rice, and regular pasta. Sugars you should avoid. Don't eat raw or undercooked shellfish. For a well-equipped, adjusted diet, eat fiber, which you can obtain from fresh fruits, vegetables, whole grain bread, and rice and cereals. And also eat meat, mainly white meat. Try to avoid red meat, and we try to be let it be skinless or without fat, and don't do a deep fry. Get just keep it cooked. Dairy products, low fat milk or slim milk, and small amount of cheese. Nowadays there are also slim cheeses which are available. And fats, which fats you should eat? It has to be good fats which are monounsaturated and polyunsaturated, such as vegetable oils, nuts, seed, and fish. And always drink plenty of water because you should be well hydrated. Do a regular exercise consisting which consistently, maybe whatever you like, you try to play a game, or you may go into a gym, or whatever, you try to have at least 45 minutes of your regular exercise every day, and it helps to burn your triglycerides and can reduce the liver fat. And most importantly, you have to be stress free. To do meditation or pranayama, whichever suits you, and try to have an hobby which will make you happy. Just get involved at least 1 hour in a day so that your mind is kept cool. Uh, Having said this, now you have to. There is certain 2 points because yeah, alcoholic fatty liver guys, when they see the scanning, they tend to stop the alcohol abruptly, and we have seen a lot of patients coming in withdrawal symptoms. The people may experience whole body restlessness, shakiness, sweating, or loss of appetite. Sometimes gastrointestinal symptoms like vomiting. They also have behavioral changes like agitation, irritability, mood swings like anxiety, nervousness, and in these patients, the heartbeat is very high. They feel there are tremors, withdrawal tremors, disorientation, they talk something and all, headache, insomnia, and even we have seen epilepsy or fits, what you call as seizures. So when you are stopping a medication, please, I mean, when you're stopping an alcohol or you're coming out of the alcohol, it can be done immediately, but you should be under a doctor's guidance. So what treatment consists is first immediately you can stop the alcohol, but it has to be detoxification for 1 to 2 weeks. Either we are using some medications to detoxify, and then when your withdrawal symptoms are all coming under control, we will start on specific medications which are required to stop the alcohol. With this words, I'm going to end my talk today. If you have any other queries, please let me know.